Great. Well, thank you for having us here. My name is Dr. Shital Vora, and as we were so nicely introduced to us by Dr. Dan, we have also Madison Sweitzer here with Global Medical Brigades. So we are just so excited to talk to all of you about this incredible organization, this organization that is not only really fulfilling a lot of opportunities for all of you as prospective doctors, as prospective healthcare professionals, but also making a tremendous impact around the world, which I know that there's a part of each of us that really want to make sure that in this journey, right, in this journey of becoming a medical professional and exploring what we want to do, is that we want to truly think about making an impact, not only on ourselves, but for the greater good of the world, right? And so this is where Medical Brigades comes in. And specifically, we'll talk about the organization, but we also wanted to talk specifically about our Greece program, which we'll get into in a few minutes. It's one of our strongest programs. Really, all of our programs are great, but one of our strongest programs, as it focuses on a very different population than some of our Central American and West African communities. So we're excited to meet all of you today. We're excited to have this talk and hopefully, answer a lot of questions. We'll have some time at the end to have some Q&A, to answer any questions that you have about international volunteering experiences, specifically in the medical field. So a little bit about us. So Global Brigades has been around for about 21 years. We just celebrated our 20-year anniversary last year, which is just a wild thing to say, right? Because we have been busy. We've been making a lot of impact. We've been growing our organization. But essentially, we are a international nonprofit that empowers communities to meet their economic and health goals. And so we do that through engaging with with university volunteers and local teams. So what really makes us different as an organization is that we have volunteers coming from all parts of the world, mainly from North America and other parts of the world. And they actually go down to the countries, which we'll go through in a minute here, go down to the countries to provide access to healthcare, provide clean water and public health solutions and economic development solutions to communities, to rural communities that are very under-resourced. And the way we do that is that we engage with local experts, with local community leaders, to weave them through the process and empower them to reach their health and economic goals. So as you can see here, our mission is to really inspire, mobilize, and collaborate with these communities. And then our vision that we've done over the last 21 years and that we hope to do for the next 21 years and beyond is to have millions of empowered community members with the resources and capacity to thrive. So really truly thinking about breaking the cycle of poverty so that they have the capacity to thrive. So, our story has been, pretty humble. We started our organization, as I mentioned, over 20 years ago when I personally was a student at Marquette University. And, and one of the opportunities that I wanted to have within my pre-health track was to be able to study abroad or do something in another country to understand how things work and to be able to make an impact and grow any sort of knowledge to be a better healthcare professional. And so specifically, at that time back in 2003, there wasn't a lot of organizations out there. There was Doctors Without Borders, but you had to be a licensed professional, which clearly, as undergraduate students, we were not. And there was Peace Corps, but you had to dedicate about 2 years of time, which was certainly hard to do when you're on a pre-med or pre-health, any sort of healthcare professional career track. And so, we took a leap of faith and we decided to start our very own organization. And, we started off just thinking it would be a group of students at the university that I was at Marquette University, and that we would just go on an annual basis to support these communities and bring these resources along with the local professionals down to improve their quality of life. But what we quickly realized is this is right around the time when Facebook started. This is right around the time when, people were connecting on different, very primitive social media platforms. The thought of this caught on, and we found that there were so many students, there were so many undergraduates that were really excited about doing the exact same thing. And so over the course of the last, the first couple of years within our organization, we grew from one chapter at Marquette University to many chapters, about 80 chapters across the US. And so as we were growing our chapters, we also recognize the problem. So going on to the next slide here. when we realized is as we were going down to specifically to Honduras on a, couple times a year basis, that most of these communities, if not all of these communities, just lacked access to basic health services, right? So typically here, if you have a sore throat, you wake up with a fever, you can go to your local health clinic, you can go to your school nurse, you can go to urgent care and just get a basic checkup, see what's going on, right? And get some medication or get some, any sort of treatment to be able to treat whatever symptoms you have, right? In an area like rural Honduras, when you have communities that are way up in the mountains that really are either that are forgotten or they are unavailable to reach because of their, their proximity of where they just don't have the ability to have that basic healthcare. So something as simple as waking up with a fever or waking up with a sore throat or a stomach ache or things like that. A lot of these individuals just don't have the ability to access those quality healthcare facilities that we may be used to in these parts of the world, right? And so that was something that was really interesting to learn, that it wasn't just, one community in Honduras, right? That this is kind of a global issue in under-resourced areas. And so as soon as we identified that problem, we quickly realized that we need to do something about this, right? Is that this is great that we're providing access to, that we're coming down to these countries, running a mobile medical clinic for the day or two within that community. But what we're really realizing is that there's more to be seen here. So this is where we developed out our sustainable solution and specifically our holistic model. So as a volunteer, Global Brigades is providing sustainable health systems within these communities by mobile medical clinics, by training community health workers, by referring patients to areas in which they can get more extensive treatment should they need it, if they have a more in-depth diagnosis. But also what we realize is a part of the root problems of some of these patients that we were seeing on an ongoing basis is that there was a lack of water and sanitation infrastructure. So people were drinking contaminated water because there's no clean water solutions within these communities, right? People were coming in with a lot of public health related illnesses like upper respiratory illnesses or illnesses that were specific to their environment because there just wasn't a lot of public health infrastructure. And then also along with that, I think all of us have learned in some capacity or another that in addition to our general health, we have our social determinants of health, right? And part of our social determinants of health are focusing on, lack of opportunity or lack of income, right? And that also contributes to somebody's general health. And as we realized that those components were truly the reason why people were living in poverty and that cycle of poverty was not being able to be broken, we started to develop out programs to focus on sustainable health systems, right? As you see here in the red part of the circle. We started to focus on economic development programs, right? And the green part of the circle. And then we also started to address the root of the problem by focusing on water and sanitation infrastructure. And that's where we coined our term, the holistic model. And our holistic model really focuses on this multidisciplinary approach, this three-pronged approach for empowered communities to rise out of poverty. When those programs and that intervention is put into place, we're able to then rise these communities out of poverty along with their local leadership, right? So we've partnered with the United Nations Sustainable Development Goals. So you may have heard about the UN SDGs is kind of what the lingo is, in terms of what people refer this to. But essentially, it's this global plan to have all these communities all over the globe to completely rise out of poverty, right? And so Global Brigades is specifically focusing and partnering with the United Nations SDGs to focus on these goals here. Healthcare access to WASH infrastructure. So WASH is just another way to say water and sanitation infrastructure, and also economic development opportunities, right? And again, it's going to break the cycle of poverty and permanently rise them so that they can reach a better quality of life. And then we're talking about sustainable change here within these communities. And, it's been really exciting to see over the last 20 years as we started to implement these programs, in community after community in the countries that we work in. And it's been really incredible to see that over time, these communities are thriving, right? We come back to these communities and people are happier, healthier, they're able to work, towards whatever goals they have. There's a lot of hope, there's a lot of excitement that's happening within the community because their basic needs are being met. And Madison, I know you've traveled, a lot to a lot of our countries. Would love to hear from you as to, what are some of the things that you've seen personally that have been implemented in these communities with our leaders to really kind of showcase the impact that's being made?
Yeah, for sure. So it is really cool to see the way that all of these projects interact. I personally spent more time in Central America. I'm going to Greece for the first time this summer, and I'm really looking forward to it. But with what I've seen in Central America, it's always really visible how like the water projects and the health projects all intersect. So, whenever we're going on a medical brigade, we're always keeping track of all the data that comes in. So, for example, if we're in a community where we see that there are really high rates of waterborne illnesses and parasite infections, that then like puts up a red flag of this community would be a great candidate for a water project. So when you're on a brigade, even if you're just on a medical brigade, like you're going to see the pieces of all of this. So even if you go to Greece, healthy water access isn't as much of a challenge there, of course, being in a larger city, but you will see things like our business program and our legal program that's like working to support the refugee community. So regardless of the brigade that you go on, of course, medical, I think is going to be the best fit for all of you guys. You'll still also kind of see all of these other programs going on in the background, which I think is kind of unique for a volunteering experience like this.
Mm-hmm. Yeah, and I think, I'm sure this has come up in some of the other sessions. I kind of heard a little bit of this dialogue before, and, seeing some interesting and really thoughtful submissions on the chat here is that, when we're working in any capacity, whether it's here in the US or in whatever country you're in, right, we're always talking about that we can treat the person's illness, right? We're trying to figure out what their symptoms are, figure out a diagnosis, and then if they need, prescription medication or other intervention, we're able to do that, right? But what we realized, right, over time, and all of you can kind of attest to this, is that there's so many different components that go into an illness and diagnosis, right? And that's really what we do on an international scale in these rural and underserved areas, is to be able to take all of those components and put that in as a factor, right? We're not just treating the person, we're treating almost the situation, right? And being able to dive a little bit deeper, understand the root causes of these issues, and being able to have a holistic and, well-rounded approach to truly support individuals in their general health. So as you can see here, over the last 20 years, we've made some significant impact. We've had over 90,000 students just like you that have volunteered from around the world. So, they have actually come down to the countries that we work in. Some of them have been able to join virtually during COVID when we did more virtual sessions. And, those students have provided almost close to 1.5 million patients with consultations and treatments. So if you take a look at, just hearing those numbers, it's pretty remarkable that, over 1.5 million individuals that previously would not have had any sort of healthcare access, or maybe very limited healthcare access, have been seen, have been treated, and also not only have been seen and treated, but been able to provide more resources to, improve their quality of life as a whole. And, we have over 300 chapters from universities around the world. So, we've grown significantly, which is so exciting. Obviously, there is, if you're getting excited by this conversation, there's many students just like you that are interested in, making an impact around the world, and making an impact in terms of, being able to do this type of work and be able to have something really meaningful. And you'll kind of see here on the map that we have here next is, you're really in great company. You can see that we have chapters, university chapters all throughout North America and other parts of the world. And, if there isn't a chapter, we're going to talk a little bit later on how to, what the process is to get involved and to start a chapter. But essentially, we're in a lot of universities that have been, a chapter for 20 years. Sometimes we have, chapters that are just starting out as of, a few weeks ago. It's been a really great journey to see that there are a lot of individuals just like yourselves that are interested in getting involved with this type of work. And not only just getting involved from a personal level, but truly, making an impact in the areas of the world that need it the most. Great. Okay, so this is a great conversation. So many of you are thinking, okay, this may be interesting. I'm very interested in the work that Global Medical Brigades is doing. I'm interested in being able to be a part of something. But why should I join here, right? So the concept here is being able to why should I join? First and foremost, we've talked a lot about impact, right? When we're looking at the work that we do within these countries and in the rural areas of these countries, the average medical brigade is seeing over 300 patients, and they're not just seeing these patients, but they're providing a lot of public health workshops, a lot of information, a lot of education that's going into this, right? So the impact that's being made is tremendous. It's not just small things that you're doing within the community. You're actually making significant impact within the community, and also impact on yourselves, right? A lot of this experience is a personal, journey of understanding what type of healthcare professional you'd like to be. It's a personal journey of, understanding, what other parts of the world look like, so that we can certainly, be better healthcare professionals and really understand cultures and other socioeconomic situations in which, we're able to take those factors into account and then be able to interact with individuals on a more, holistic level. Also, a sense of belonging, right? When we are talking about Global Brigades, you saw we're in over 300, chapters across the world here. You're joining a movement that a student movement that's passionate about improving the access in really vulnerable communities, right? A lot of times, we will meet other people that have volunteered, volunteers that have been a part of the organization, and there's a common language, there's a common thread there, right? Some of my closest friends from when we went on our first brigade, are now a part of, my personal life. And it's been, such a wonderful opportunity to meet individuals that are very like-minded, that feel like this work is really important, but also just, again, be a part of a greater movement that is really creating sustainable change across the world. Also, there's an incredible opportunity to grow. So going back to the last slide here, you're getting really valuable international clinical experience. So I know that throughout a lot of what you guys have been talking about today at the different workshops, there's shadowing opportunities that are really important as a part of your, development as a pre-med applicant, or as a healthcare professional in general, is to be able to really understand, what it looks like to do this and really see if this is a good fit for you, right? And then also getting international clinical experience is such a great opportunity to be able to experience and to be able to have, something that you can talk about on a personal level as it relates to you, and why that would make you a stronger healthcare professional. And then certainly, being able to travel to these countries and be a part of something big is just a lot of fun, right? So this is, an opportunity to see other cultures, to experience, travel on a very different level than just a personal vacation. Making impact, creating a lot of relationships is a large part of this experience. So that is, a little bit about, what you can experience on a medical brigade. So as I shared, Madison, would you like to add anything else in terms of, I know that you've been, on several brigades, if there's anything that you feel that from your personal experience or students that you've interacted, anything that you'd like to share when it comes to that experience overall?
Yeah, I mean, I think thinking about the brigade experience, I like that we do highlight that it is also really fun, and that you're also doing it with a group of students that are like-minded from your school. Chances are there will be, other universities that are there at the same time. So, in addition to, what you're doing individually in terms of the shadowing hours and getting to make a really positive impact, you're also just getting to connect with a lot of like-minded people, which I think can be, a really fun, cool network to be a part of as well. So I feel like that's worth thinking about.
Great. Okay, so we talked a little bit in the beginning. We're in a lot of different countries. We're primarily focused on Central America, West Africa, and the country of Ghana, and then one of our more recent programs over the last 3-4 years has been Greece. So we have a very strong health program in Greece, and people always ask the question, well, why Greece? Why are you doing medical programs within Greece? It seems like it might be more of a developed country than maybe some of the other countries that Global Brigades is in, such as, Honduras or Guatemala, what's kind of the reason why that you're doing the work in Greece. So it's a very interesting demographic in Greece. So there are surrounding countries that have a lot of different challenges. And so Greece actually receives a lot of refugees and asylum seekers that are facing a lot of serious barriers. And also, there has been an influx of refugees coming into the country, which, Greece has been very gracious in opening their borders and supporting those individuals to start a new life, to create a new opportunity, a new beginning, so to say, even during challenging times. But certainly any sort of influx of population within a country can really overwhelm a health system, right? It overwhelms a lot of different systems. Specifically speaking, the health system has been certainly overwhelmed, right? And so what happens in that situation is when there's a tremendous influx of individuals that are, coming with very limited resources, things like limited transportation to be able to get to a health clinic if an issue happens. Things like affordability, right? They're typically under very stressful socioeconomic situations or economic situations. So affording medical treatment can be very difficult. Also, they may be speaking different languages, right? And so sometimes going to a local Greek clinic where maybe Greek is a local language to be able to communicate and address the health issue with their other language that they speak, it becomes a challenging barrier, which we see in lots of, you may see in some of your community, right? But certainly very present in Greece. So, with this overwhelming kind of influx of refugees, we certainly want to ensure that they're getting the treatment and they're getting the resources that they, deserve and they need. And so that's where we have, come in as medical brigades, is to provide affordable, accessible, and most importantly, culturally competent care with our volunteers. And so, it's been about, several years that we've been in Greece and we've been working with this population, and it's been an incredibly impactful experience. And, and it's been a really important experience to be able to, provide these individuals with the resources, despite, all the changes that they're undergoing with, moving into a new country. So, we'll talk a little bit about this on the next slide here, and, just some statistics that we wanted to share with all of you. Is that, as I mentioned, our work is focused with this particular population. And, this population is a significant number. It's about, 10.8 million people within the country. And, of those individuals, this is, we're having close to 120,000 refugees that are living in Greece. So you can kind of see that could certainly overwhelm, the health system that's within Greece. And, specifically, Athens itself, as the major city within the country of Greece, has more than 40 migrant and refugee communities. So it is heavily populated. There is a significant amount of migrants that are in the area, and certainly they're looking to get the basic services after being transposed to this country. So what we're doing here as medical brigades is that we're supporting these communities by public health education, by other programs like legal and business programs, and certainly, most importantly, by providing their basic medical needs through some of our local clinics that we're able to launch within the country of Greece. And Madison, I know that you're heading out to Greece in a couple of weeks here. Specifically, what are some of the things that you're looking forward to seeing in terms of, the program and some of the specific interventions that Global Brigades is able to make within the country?
Yeah, for sure. I'm super excited just to compare it to the other locations too. So, in Central America, we're in a more rural area. In Athens, we're going to be in, much more urban center, of course. And something that's really cool about the clinic in Athens is that it is operating year round. So, as a volunteer, you're able to just kind of jump right in and see what's going on, but that when you head back home, that the clinic is still running. So it's really cool to see the progress that it's made. The clinic in Greece has also expanded to include a lot of different specialty stations. So Shital's going to talk a little bit about that later as well. But it's cool to see that they're also, providing things like dentistry and like other more specialty care that's even harder to find for this community.
Absolutely, absolutely. And so, one of the biggest questions that we get here is, we have a clinic in Greece that volunteers are able to, really work alongside local professionals and local doctors. So, people always ask, okay, well, so what does a volunteer, if I were to go to Greece, what would I do as a volunteer? What would I do during specifically a medical brigade? So we're going to take you through what it looks like to volunteer on a specific medical brigade. So going on to the next slide here. This is kind of a basic diagram of how things are laid out in the volunteer experience that you'll have. So we have a local team on the ground that is there to prepare, for the medical brigade by letting all of the population know that we'll be hosting a medical brigade specifically for them prior to your arrival, right? Prior to your brigade starting. And so here is a typical diagram of what it looks like. So our first station here on the bottom, as you can see where it says number 1, it's our intake station. So that's typically where, so you see, all the kind of patients lined up there, they would go into the intake station, and that is where we would take a basic information, their name, their age, where they live. Part of what Global Medical Brigades does is we do collect the patient information so we can track impact over time. And so intake is the first place where we're able to collect that information so that we can certainly do that. And then from there, they're going into a consultation room, consultation room specifically for either ophthalmology or pediatrics or any sort of general care. So at that point, intake is also where they receive a lot of vital signs, and we take kind of their basic information, their baseline. And then from there, the consultation room is essentially where the doctors are specifically, and doctors and other healthcare professionals are specifically residing so that they can actually be seen and treated by that specific doctor. So the doctor is sitting down with the patient, oftentimes with the translator. You're able to, as a volunteer, shadow this entire experience and, see the physician, take them through, from beginning to end, what a typical consultation would look like. So this is where they would take a look at, all the different areas in which their major complaints are coming from. This is where they have conversations about some of the background that may be contributing to their diagnosis, right? It's broken down also into different age groups. As you can see in pediatrics, there's a significant population of children. So we like to have a specific focus on that. So that's where that happens. And that's where a lot of clinical shadowing happens. So if you're interested in getting clinical shadowing hours or just exposure to that, this is where a lot of that happens as well. And then we have, a couple of specialty stations that are highlighted here in yellow. So station number 4 and 5, we have a pediatric station where if there's some more extensive consultation that has to happen for the pediatric population, that's happening there. Sometimes some very basic procedures could happen in that station, or some more extensive conversation or extensive, analysis can happen in that area. And then we also have an OBGYN station. And this is, really to support the maternal health and prenatal care for a lot of individuals that are in that are pregnant or looking to be or having to have female health issues. So that specific area is very much focused on that demographic there. And then also we then have the station where we focus on the children's corner. And that's a lot of where public health education happens, right? Simple things like the importance of washing hands, simple things that, people may not have the basic knowledge of. That's where a lot of this workshop and a lot of this conversation happens, because again, knowledge is key, right? And sharing a lot of that knowledge is going to be very important in order to have a healthy lifestyle. And then, the last station here is our data informatics station. And again, that's where we actually track, we input all of the patient information and create this sort of patient chart, so to say. And from there, we're able to really then track that patient's health over a significant period of time, right? And then we have a couple other areas here. We may have some health screenings happening at different shelters, depending on the location. Also educational shelters, if it's not at the urban clinic that we have in Greece. But this is kind of basically what you would do as a volunteer. You're able to shadow, you're able to support in taking vital signs and creating, or creating an environment in which a patient is feeling comfortable and being able to see, what typically happens in this type of setting.
Great. Oh, I was just going to jump in and say we also have a video. So I will jump on over there so that we can kind of virtually walk through everything.
Great. This is a video of specifically, as Madison said, what our clinic actually looks like. And you'll see here, one of our team members, Krisa Prezziti, is giving us a nice tour of what our clinic looks like in country.
The best, Michelle.
Hi everyone, welcome to the GB Greece Clinic. Here is our waiting area. As you can see, we have some coloring books, some markers, and some toys in order for the kids to be entertained as they wait. And here is a data intake station. Volunteers and staff take the patient's personal data and book new appointments when they have them. As you may already know, we have 3 specialties in the GB Greece Clinic: an ophthalmology, and pediatrician, and an OBGYN. We're going to see the consultation rooms now. Here is the ophthalmology consultation room.
So you can kind of see the consultation room has a significant amount of equipment to really truly treat, and be able to see what's going on with the patient.
We will go to the OBGYN.
And similar to the OBGYN station, we've have a lot of equipment to be able to have proper diagnosis and have, a safe place where women can go and get their health taken care of.
OBGYN. We're going to see the consultation rooms now. Here is the ophthalmology consultation room. And over here, we will go to the OBGYN.
So we're having a little bit of repetition, that's okay. But yeah, as you can see here, we have a significant amount of equipment that we've invested in to be able to truly be able to, get this, get as much proper diagnosis and proper intervention as needed. A lot of these individuals, may have some general things, but oftentimes our patients do come in with a lot of complicated diagnoses in which we can certainly take the time and utilize these resources in which, it may be the first time they're seeing some of these, these resources, but, truly getting down to the nitty-gritty to ensure that they have the best care possible.
Awesome. Thanks, Shital. Let me move over to our second video here. Sorry, we had a little bit of repetition. I've been keeping up with all the interest in the chat. I'm so excited to get so many good questions as we go. Here's a little bit more as well of our pediatric areas.
We have the pediatric consultation rooms because most of the patients are kids. Here is the first one.
Yeah, and as we mentioned earlier, there's just a significant amount of children that are coming into the clinic.
And the second one, the one with the better view.
And some of these children have never been seen in this type of clinic before, so we try to really create a comfortable environment for all of them.
Bye.
Great. So, this is just a snapshot. We wanted to kind of show you exactly, what our clinic looks like. And, again, as we talked about in the diagram earlier, students are stationed in different parts of, the clinic to be able to truly see, shadow, and be able to be a part of, the patient experience and learn about bedside manner and all these different things. An area specifically that's very exciting within our Greece clinics and also our medical program in Greece is that we are looking to expand even more so on our OBGYN and ophthalmology stations. And then also there is a significant need for dental care within this population in Greece. And so we are looking to expand. We have some partnerships that we're developing in country to be able to run dental programs within the communities or within this community so that they're able to receive really strong oral hygiene. They can get, basic things like extractions. I'm sure all of you have, or most of you, hopefully not, but have had, dental issues, and, that can be really painful. And so, a small station where we can, or an area in which we can address dental issues to provide them immediate relief, and also just over time preventative oral health care is certainly something that is being included into the clinic over time. So that might, when you go on your brigade here in the future, you will probably see a dental clinic within our GB Grease facilities very soon. Great. So, I'm seeing a lot of really great questions in the chat, and we're going to kind of go through, and Madison's been kind of answering some of these questions. We're going to have some time for Q&A at the end, but I'm seeing a lot of questions about, how do I get involved? And, what are some things I can do to be a part of this? And we're going to go through that right now. This is, really where a lot of those questions can be answered. And I'm so excited to see those questions come into the chat, because we want you to get involved. There's certainly a need within these communities, right? In any of the countries that we work in, and specifically, as we mentioned, within the asylum seekers and refugee population in Greece, there's a lot of need there. We need a lot of volunteers to support that community in really bringing the quality of healthcare up. So specifically, each university has their own chapter that really operates like a club, right? So they're structured differently, and we can talk a little bit about that. Madison kind of touch a little bit on that. But then also, if a university does not have a club, we encourage you to start a chapter. And it sounds daunting, but it's a very seamless and easy process, because we have our teams that will take you through the entire process to start a chapter. So specifically, as leadership roles, and that's, something that's very important as a, as a pre-med applicant, right? As somebody that's aspiring to be, a prospective doctor, right? There's a lot of things that you can do to gain leadership experience, right? And this is exactly one of those opportunities, is through recruiting and coordinating volunteers, through supporting with, getting students to be excited about the program and about their brigade. There's a lot of community organizing that's happening, and those are straight leadership opportunities for all of you. Also, healthcare project management, right? Where you're able to, as a leader, lead healthcare initiatives in under-resourced areas. This is such a tremendously incredible opportunity to be able to be exposed to, and then also be a leader in that space. Also advocacy, right? There, as we've talked about earlier, that there is significant healthcare disparities that are happening around the world, right? And this is why Global Medical Brigades exists, is to address those disparities and really hopefully bridge a little bit of that gap, right? And really being advocates for equity. And that's really what, if that's something that speaks to you, this is such a great program to join the movement in order to really advocate for that equity. And then also, as we talked about, there are some scholarships. There's been a lot of questions about, about fundraising. And so there are scholarships available. We have our team members that are available to be able to learn a little bit about, as a leader, you certainly are eligible for a scholarship. And that's something that, can kind of take a little bit of the pressure off for you if the fundraising is a concern. But again, we have different ways in which we can support you as a leader and ensure that, you're being, celebrated for the leader that you are within the medical brigade side. Madison, if you want to maybe take a second to chat a little bit about, what our teams look like and how they are able to support either, an individual that's excited to start a chapter, or an individual that's excited to just join a chapter that may already exist at their university.
Yeah, for sure. So we definitely are getting a lot of really great questions in the chat of like, okay, I'm interested. What do I do now? And we have kind of a couple ways that you can do that. So I'll just kind of walk through, what those options are. And like Shital said, we're, working with you on this. So, regardless of the option that you choose, you'd be working with someone from Global Brigades to help you throughout the whole process. So we really rely on the chapter model, and a chapter is basically a club at your school. It's, a cohort of students. And the reason for that is because there's so much more impact when you are, growing with a big group of students from your school versus just signing up individually. So we always really encourage you to get involved on campus or start a chapter at your school, because that's going to be, the most sustainable and impactful way to do this in the long term. But that being said, the first option to getting involved would be joining a chapter at your school. You can confirm, on our website if there's a chapter, or I would recommend, checking on the student activities website just to see if there's already a group there. If there is, great, super easy. You can reach out to them. Let me know if you need help finding their contact information. If there's not a chapter at your school yet, I would definitely recommend thinking about starting one. Like Shital mentioned, there's a scholarship available. This is going to be the most sustainable. It's going to leave a legacy on your campus. You know, we have brigades that go year after year. And it also means you get to choose exactly where you go. It means you're going to go with a group of friends from your school. This is really a great way to get involved. Or lastly, if you've recently graduated, maybe you're in your gap year, maybe you're just in a situation where it does make more sense for you to jump in with another group. We'd be happy to help you with that too. One kind of in between option for that too is if you're thinking, I want to get this started at my school, but maybe I want to go first to see it myself. Because it does take some time to get a chapter started. One kind of third option would be jumping in this summer with another university. As soon as May or June, we can get you on a brigade, and then you can come back and start a chapter at your school in the fall, having an experience under your belt. So that's a great way to do a site visit. You'd see everything live, and then can get a chapter started after that. So basically, whatever you're looking for, we can help find something that'll work. I recommend filling out the form at the end of this presentation. That's going to be like the quickest way. Someone will follow up with you really early next week, and we'd love to work together with you.
Great. Thank you, Madison. And, one thing that I want to reiterate too is I know that many of you have a lot on your plates, right? You're with a lot of you have a lot of classes, you're doing a lot of extracurriculars. This has been designed to our team is there to support you throughout the entire process. This isn't just here's kind of the template and then go ahead and try to figure out, guys. No. We have teams that are dedicated. We have volunteer engagement associates and program associates that are dedicated to take you through the step-by-step process. If you are encountering any challenges in starting a chapter or joining a chapter, our really experienced and really passionate teams are there to take you through the whole process and kind of eliminate all those challenges and have you enjoy the process, right? And, I'm sure all of you have chatted about today or in previous conversations that, clinical hours, leadership experience, being able to speak really highly of what type of, healthcare professional you want to be is a large part of the journey of the pre-med experience, right? And this is really hitting on a lot of those points, is being able to be a part of a student movement like this that is really focused on all those, specific areas that really make you a standout individual. And again, our teams are so excited and passionate and dedicated to make this as easy and as fun as possible, so you can focus on making the impact and making, making the change in the world that you hope to make. We have an entire fundraising process. So a lot of questions that have come through is, what does this mean? Is there a cost to this? So essentially, you are fundraising to participate in the medical brigade. So our teams have all these steps and resources to be able to, give you ideas on how to fundraise so that you're able to participate on the medical brigade. You can also donate directly to participate on the medical brigade. And so not only are you funding those donations are going towards your brigade experience, which is, getting in country and having that experience in country. But it's also going towards important supplies, medication, and also the staff that's there year round to really implement the holistic model, right? So we talked a lot about in the beginning that holistic model is truly important in addressing the needs within the community. So essentially, that's where the fundraise, that is where the donations are going to, is kind of make that entire sustainable a sustainable plan happen. And also, as we mentioned earlier, if you decide to start a chapter or if you're becoming a chapter leader at your university, you'll absolutely be eligible for a scholarship to cover your participation, which even includes flights. So certainly, a lot of individuals are excited to start chapters so they can kind of take that off of their plate and focus on growing their chapter on their campus. And, as Madison said, leaving that legacy on your campus and leading that legacy and the impact that you make in the communities is absolutely a remarkable and transformational experience, right? That's something that you can certainly look forward to and be proud of over time, as you're going through your journey. So here, we're excited to, share a lot of this material, information for you. We're going to take some time for some Q&A, but here is, we encourage all of you as you're asking questions and as we answer these questions, this is a great time to take out your phone and, and take a look at this QR code and put your name in so we can start answering questions and start offering you more information if you're interested in this program. As an individual that was a part of Global Brigades since day one, it has made me into a much stronger healthcare professional. It has provided so many opportunities for me, and I can say this for almost all the 90,000 volunteers that have been a part of the organization since day one. Right, is that we're not just doing a short-term trip. We're making long-term impact in the areas that need it the most, while also being able to be leaders and advocates for those that are really in vulnerable populations. So so definitely take some time as we have a few minutes here to put in your information from this QR code. But Madison, maybe we can go through some of the questions, the common questions that we're getting here in the chat and also in the Q&A box, because these are all just really great questions that I know that in our short time with the presentation, we can't go through all the information, but we want to make sure that we're able to answer some of the more pressing and more exciting questions that are coming in your way.
Yeah, definitely. So one kind of question we've gotten in a couple iterations is just, how does the cost of all this work, especially, as a student, we get it, it's international travel. That is, of course, always going to be a really big question. So I want to give kind of just a quick overview of, how that works. So all of our brigades have what we call a donation goal associated with them. And the donation goal is going to cover everything that's involved with your brigade. So flights, meals, housing, and then most importantly, it's also supporting the clinic that you're visiting year round. So when we talked about how there are public health programs and business programs and water programs all going on in the background, and these clinics are open year round, that ties back to the donations that you're making as a chapter. So everybody that gets signed up will get their own online fundraising page so that it's really easy to share with friends and family, do fundraisers on campus. And then we also have a scholarship for the chapter leader. So that donation goal is going to vary a little bit depending on location, but it's going to be between $2,500 and $3,500. But again, we have a lot of fundraising available. If that's the only thing that's intimidating you, don't let it hold you back. We'd be happy to work with you and make it happen.
Great. There's another question that I've seen a couple times come in. It's such a good question. Are these set dates or are these flexible dates? That's a really great question. So as a chapter leader, you're able to set the dates that work best for your chapter. We do have oftentimes, or sometimes we do have some set programs with set dates for those that can jump in. But for the most part, all of our universities are setting the dates that work best for them. Most university chapters are setting dates based on when they have their spring break, when they have their winter break, or during the summer months when they are not in session, when they don't have classes in session. But essentially, you are able to talk to our team members to say, hey, these are the dates that work for us. And is that available? And we'd be able to kind of take you through that entire process. So so all of this is mostly very flexible. It's kind of based on what your chapter, what works best for your chapter. And if there is some sort of, barrier in that, we'll be able to absolutely work with you to make other options work.
Shital, we've also gotten some questions and some interest on telebrigades. I don't know if you want to talk a little bit about what that looks like.
Yeah, absolutely. So, the history of telebrigades has been very interesting. So as you guys remember, not too long ago, we had our global pandemic, which really turned the world kind of upside down. So primarily we're doing in person. Before the pandemic, all of our volunteer experiences were in person. What that means is student volunteers actually going into Honduras, right, to Panama, to Greece, to be able to participate in their program. But then when COVID happened, obviously all travel came to a halt. And so we were very committed to making sure that our communities still were receiving the support and the commitments that were made by the organization in terms of bringing resources and supporting them in any way that we can. And so that's where we took every program that we have, and specifically our medical program, and we turned it into a virtual telebrigade program. So a virtual experiential learning program where you're able to participate in medical consultations. You're able to see how telehealth works. You're able to sit in on consultations on a virtual standpoint by shadowing doctors virtually over Zoom, to be able to see, how healthcare works in the countries that we work in. And, this is also a great opportunity for those that may be hesitant to travel. Not everybody is wanting to get on a plane and go somewhere. Some individuals may feel more comfortable having this type of experience over Zoom or virtually. So our teleprograms are very much focused on exactly what we're doing here. It's face-to-face interaction with our local healthcare experts, with local community members and patients that are coming into the clinics. So we actually have equipment within the clinics in which telehealth is happening, and you're able to sit down. Of course, the patients, have consent to that, but you're able to sit down with, Zoom in and really see these consultations happen. And we also have healthcare professionals that take you through, the entire medical diagnosis of an individual. Why does this illness happen? And it takes you through the, etymology of all that. It takes you through the pharmacology of why certain prescription medications are given, right, in that particular area. So if you are interested in more of a virtual opportunity, that is certainly present as well, and as well as our in-person opportunity.
Awesome, thank you. And some people are asking about like the sign up process. So it's the same as in person. We have different chapters that have groups, or if you want to get connected to another chapter, same exact process. So I would say fill out the form, or I'll drop my email in the chat again too, if you want to send me a quick email with your background, and then I can help find the exact information for you.
Great. Another question that has come up a couple of times is, what's the difference between a chapter leader and a volunteer? So yeah, go for it, Madison, go for it.
Yeah, no, good question. So the chapter leader is kind of like the ambassador on campus. They're like the liaison between everything that we're doing. We manage, all the logistics on the ground. So don't worry that you need to like find a place to stay in Honduras for your brigade. We have you covered with all of the in-country logistics, but then your role is like being, recruiting other students to join, helping them fundraise, and like being that club leader. As a volunteer, you'd have a little bit less responsibilities in terms of organizing all of this, but you would still be working on fundraising, and you'd still be just as hands-on on the brigade. So if there's already a chapter at your university, joining in as a volunteer is a really great option still.
Great. Another question is, are pre-med students that have already completed undergrad eligible to volunteer?
Definitely. We'd love to have you. It's a great gap year experience. It's going to be fun. It's going to get you more clinical hours. We also have med school students that volunteer with us, which is really cool because once you get farther along in med school, you can actually practice depending on the country that you're going to. So you can only be more and more hands-on the farther along you get. So we'd love to work with you.
Mm-hmm. Another good question that came up, thanks for that, Madison, that has come up is, are there American or internationally trained doctors on the trip? That's a great question. So we have local, and when I say local, so they have, local Greece, local Honduran, local Panamanian doctors and healthcare professionals on every brigade. In addition to, if there is a, healthcare professional that whether, it's within your university system or a family member or somebody like that wants to join the brigade, they're always welcome. But we do have healthcare professionals from the countries that you'll be visiting. Like for Greece, for example, we have Greek doctors, Greek pharmacists, Greek nurses, et cetera, that are focused that really know the demographic and know the needs of their particular communities and the particular areas in which they are most experienced in. And also, being able to really truly understand some of the cultural aspects of treating the patients, right? So a lot of what we stand for within Global Medical Brigades is making sure that we're volunteering ethically and culturally sensitive with a lot of cultural sensitivities. So we do have healthcare professionals from the specific countries that are joining your brigade. And it's a really great way to have some cross-country collaboration, right? And cross-country experiences to be able to learn from a Greek doctor, right? What do they typically see? What are some cultural or social things that we may not be aware of, not being from that country, that could contribute to treating a patient, right? So those are really important things that are happening. So we have local folks that are healthcare professionals that are coming in and really supporting that system. Great. So I think the last question that I've seen is, how does this help me within my journey or my career? As we shared, a lot of what you're learning today, or what you've already learned throughout this entire experience of being a prospective healthcare professional is there are requirements for extracurricular activities, right? There are. It's really great to have international volunteer experience, having clinical shadowing experience, right? What's really really exciting about this type of program is that it encompasses so many things into one really meaningful and impactful program, right? So if you're looking at something, if you're looking at, how do I tackle all of this while also doing good in the world, right? This is a type of program that is really focusing on all the aspects that really make you a great potential applicant for medical school or for any other healthcare profession. It also creates an opportunity for you to, see how other healthcare systems work, which is also such a contributing factor in being a strong healthcare professional. So, I think that you'll, as you talk to your PAs and VEAs and other team members, if you're interested in joining the organization, you'll see throughout the entire process of preparation, and certainly while you're in country making impact, that these are the types of things that are really present, and these are the types of things that are going to be things that stick with you throughout your entire journey as a healthcare professional. So it's a really incredible program. It's a program that is making significant impact across the globe. We invite you to be a part of this movement, and hope to see you all in country really soon, or virtually a part of what we do with medical brigades.
Thank you so much to both of you, Dr. Vora, Patty. This was incredible. Like we heard from the deans, having those extracurricular experiences and ways to really give back to the community is so important, and this is just a wonderful way to do so. You can prove your leadership skills, you can demonstrate the volunteering aspect of it, and you could really explore the world. So Global Medical Brigades is just an incredible opportunity, and thank you so much for talking about it, because this is really it's a once in a lifetime experience for pre-meds really who can go out and sort of share their experience with the world too. So thank you again so much for that. Here's the QR code, and obviously everyone who's going to be getting emails after this session, you're going to hear more about this. I know that Madison was putting her email in the chat as well. Is there, any last minute thing, any way for people to get in contact with you if they still have questions?
Yeah, no, please do. I'm excited to see that I'm already getting emails. As you can probably tell from a lot of this, sometimes the answers are really personal, whether it's, is there a chapter at my school and how do I get this set up? So the best option is to fill out the form or send me an email, and we'll find another time to connect with you one-on-one so we can go through all of the options with lots of clarity. So we'll ask for just a tiny bit of patience to fill out the form, but we'd be happy to book a call with you, as soon as Monday, to go over some of the options and figure out what's going to work best for you. But thanks everybody for joining. We're really excited to get some new chapters off the ground after this.
Thank you for having us, and we are so excited to have each of you a part of the really massive student movement and making, healthcare a lot more equitable. So thank you for having us, and we hope to see you in country or virtually very soon on one of our programs.